Hello, this is Dr. Patrick Nemechek, and I'd like to give you a quick review of the Nemechek Protocol for autism and developmental disorders. At its base, the premise is that a condition called small intestine bacterial overgrowth is essential for the development of autism and most developmental issues. Small intestine bacterial overgrowth was discovered approximately 60 years ago, and it is the state in which normal bacteria in the colon are now living in high numbers in the small intestine. This results in the production of excess propionic acid, which in animal studies has been shown to suppress and alter cognition, and this also can impair neuronal pruning and repair process through an inflammatory cytokine release and the release of LPS, resulting in activation of primed microglia. The essentials of the protocol are fourfold. 1. Simple balancing of the intestinal bacteria with either a prebiotic fiber or an antibiotic rifaximin. This can reduce propionic acid, reduce inflammation. Supplementation of omega-3 fatty acids from fish. They contain particular fatty acids that are required for the nervous system and reduce inflammation. Olive oil supplementation, which contains in high amounts a omega-9 fatty acid of oleic acid, which further reduces inflammation from omega-6s in the diet, and short courses of vagus nerve stimulation, which have been shown to reduce inflammation. In the rebalancing of the intestinal bacteria with either inulin or rifaximin, you can have a somewhat renormalization of the balance between the bacteria in the small intestine and the large intestine. Within a few weeks, the leaky gut, or what is otherwise known as bacterial translocation, will recover. This results in lower production of propionic acid and causes the patients to have a sudden increase in cognition and awareness, often referred to by the parents as the awakening, and causes a dramatic reduction of systemic inflammatory stress. Balancing the bacteria goes through a series of steps. In most of the younger patients, we always start with inulin when available. If that fails, which you can at sometimes, we use intermittent courses of rifaximin, but actually our preference now is for a monthly 10-day cycle of rifaximin every month to maintain intestinal bacteria. In a small number of children, even the monthly rifaximin is not so effective, and we find a very, very high response rate from continuous rifaximin. The omega-3 and omega-6 fatty acids, from an evolutionary standpoint, we should have had about a 1-to-1 balance between these two groups of molecules. The omega-6s are natural molecules that turn on inflammation, and omega-3s are natural molecules that turn them off. Unfortunately, in the modern diet, we are at about a 20-to-1 ratio, in particular because the high concentration of vegetable oils containing an omega-6 called linoleic acid. In order to rebalance this, we use olive oil, which has the oleic acid, omega-9 fatty acid. This will actually reverse the toxicity of omega-6 fatty acids, as well as add an additional amount of omega-3s from fish oil. Vagus nerve stimulation, or VNS. There's a mild current can be applied to the ear in the concha, as shown in this picture, which is painless. You only need to do it 5 minutes a day, and has an excellent safety record. This will lower inflammation for about 24 hours. Vagus nerve stimulation has been used in adults and children for severe epilepsy for approximately 20 years. In our protocol, in a review of 407 subjects, on average they were 8 years old. Most were male, and on average they had been on the protocol for 21 months. 80% of the subjects using our protocol showed very significant gains being defined as a marked increase rate of recovery as assessed by the parent, therapist, and teachers. To control the gut bacteria, we've used inulin in 22% of our subjects, and 78% required rifaximin. 81% of those using the transcutaneous vagus nerve stimulator showed improved speech, focus, and reduction in aggression. The brain is actually programmed to heal. Modern science is telling us we have very powerful repair mechanisms that we were not even aware of 6-7 years ago, that through the reduction of inflammation, the nervous system can heal itself. All aspects of the nervous system seem to be recoverable. Many of the genetic abnormalities noted in children with autism do not seem to be a barrier to get neurological recovery. And interestingly, rebalancing of the gut bacteria is often shown to reverse failure to thrive with increases in growth and weight. Thank you very much for taking your time to listen to this presentation.